Okay, in this video, I want to talk about mid and upper back pain or tightness that we can get oftentimes in golfers and lifters or exercisers, where we get what feels like a trigger point or this tightness through that mid and upper back, sometimes around the scapula. That can be, well, it can stick around for a while. It can be tight, tender. Sometimes it can ache or radiate pain even into the arm. And sometimes it seems like it's coming from the neck, or we're just not quite sure with it. So what I want to do in this video is describe or explain a little bit about what's happening here in the mid and upper back. What are some kind of principles of rehabbing or starting the process of making that feel better? And what are certain areas that we should be attacking, things we should be looking at? And then, of course, giving you exercises and drills to help improve on these areas and principles. So first, what is typically happening in golfers or lifters when you get that mid-back kind of tightness, spasming, sometimes in the upper back as well? A lot of times we think it's a trigger point, so there's common regions or areas in the mid upper back or close to the scapula especially, and upper traps where we get common trigger points. But the question is it actually a trigger point? Is it not? And if it is a trigger point, why? Why is it there? What's happening? So if it is a trigger point, some things that we want to consider is, do we have rib cage mobility? So are those muscles around there chronically compressed and tight? Do we have thoracic spine mobility? Again, this would mean that the muscles around there are chronically compressed or tight if we don't. And then do we have good shoulder mobility, which can be a sign of whether these muscles are allowing that scap to move or if they're not. If it's not a trigger point, we have to ask what else might it be? And a lot of times it's coming from the neck. So we can get some symptoms that radiate down from nerve compression or other issues at the neck. It will actually create symptoms in the mid-back or into the shoulder or over towards that kind of scapular region, where we have to rule out and do some work through the movement and create movement at the neck to help restore this painless area or function to this area. So trigger point or not, a lot of our rehab or symptoms are going to be the same. We just might have to include more work at the neck. Otherwise, we still want to relieve symptoms at the spot where we're having them, which will mean we need to create some expansion at the rib cage, thoracic spine, and from scapula to scapula. Expansion and mobility, rib cage, thoracic spine, stability, motor control with the shoulder blades on the rib cage, strength through the shoulder in general, and then, of course, getting back into different positions at the CT junction or that thoracic spine and neck. So, again, stability at the neck and the thoracic spine. So, if you're having symptoms in this region, I want to walk you through kind of step-by-step process of movements to try. Again, at home, we're not really sure what's happening with you. If it is a neck problem showing in the mid-back, or if it's truly a trigger point or a muscle spasm or even muscle sprain problem, work through this process anyways, and we'll kind of check the boxes. And you certainly can't go wrong just by creating improvements in human movement and function in one region, even if that's not the problem area. So what I want to start with, we're going to walk through some cervical spine movements, some extension work, trying to get you back into deep neck flexion. And you can notice as you do this, your symptoms might get better. Continue to do it. See how it feels. We'll give you some movements, some rep ranges. After that, we're going to get into the rib cage expansion. Trying to create some width between shoulder blade to shoulder blade. And again, just get you moving through this part of that spine and rib cage again. After that, we're going to work on the scap specifically at trying to get it protracted and then strengthen the scapula from this kind of protracted position, which can put you or makes it possible for you to create expansion at this spot and be strong and operate from there, right? So if we create some movement at the rib cage and spine again, doesn't do us good if the scaps can't operate in this kind of wide or lengthened position. So we'll get good at creating more expansion in space by getting the scaps out and around and then being strong and being able to control or know what that feels like. Last, on top of that, we're going to work on shoulder range of motion, shoulder strength, stability. That kind of puts these things together, where we're asking for good thoracic spine extension, some good cervical neck positioning as we move through shoulder range of motion stuff and challenges at the shoulder. These are cervical extensions. This is a McKenzie exercise. So what we're doing with these cervical extensions is we're trying to drive some spinal extension back into what is going to be the CT junction all the way up to the top of the cervical spine, right? So we tend to spend a lot of our time in this more flexed position in our normal daily posture, sometimes getting some extension back into these joints. Extension tends to be one of the first things that kind of goes missing. And when we have this chronic upper back and neck pain, and even some of this tingling pain down into the arms, these McKenzie extensions can do us a lot of good. So there's a few different ways we can do them. We can do them laying down like this off the edge of a bench or a bed. And what we want is to get your entire head and neck off the edge, right? So you can get into as much extension as you have. The position here starts with us driving our chin kind of down into our neck a little bit. What I like to think of it as is trying to get your face kind of perfectly parallel to the floor and to the wall, or sorry, to the ceiling. And we want to keep it there as we start to now drop our head down. Again, try to keep your face perfectly parallel to the ceiling as we drive our head down, down, down. And then only when we can't do that any longer do we let our head start to extend like this. So we're actually creating some great extension just through this motion here, and then we get to really take it to end range by letting your head drop, 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 and add a little wiggle at the end to get as much extension out of it as you can. So this is like a passive, great passive McKenzie extension movement there for the cervical spine. You can also do the same thing seated, right? So if we're sitting normally, what we can do is just try to drive face parallel now to the wall and then keep it there for as long as we can as we bring our head back, 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 and then we can let it extend and open up like that. This is something we're going to do as many reps as possible, right? So up to sets of 15 to 20 reps at a time. Take a little break and then do 3 of those, trying to work up towards up to 100 reps a day, even more sometimes, right? So we shouldn't have too much discomfort with a position like this. What's key is to do a lot of them and to get to true end range each time. See if that starts to make a difference with your symptoms or range of motion. Okay, this is our DNS starter position, or actually a modified DNS starter position. Face on, this is what it looks like. We're going to be on our hands and knees. From here, we're going to sit back a little bit, find somewhere right in the middle, from all the way up forward towards your hands and all the way back down towards your heels, so somewhere right in the middle. We're going to bring our elbows a couple inches away from each other, and then our hands to our forehead like this. From here, what I want you to do is breathing through the belly. I want you to feel that expansion as you breathe in into your thighs, and then as you breathe out, I want you to feel the expansion of your stomach and abdominal area start to release, so you feel less pressure into the thighs, more pressure in the thighs. I want you to feel the whole belt line start to expand as you breathe in. Now up here, I want you to think about getting as long as you can from the top of your head to your sacrum or your tailbone. So we're trying to get long through the spine, and we can use this pressure as we push down into my hands here, and I push back up into my head through my hands. You can use that little bit of pressure to get a little bit more extension, so I can kind of reach my arms away as I push my head into my hands, and I'm still just trying to get as much length through the spine as possible. From the side, it looks like this. I'm somewhere right in the middle. I'm breathing through my belly, feeling the belt line expand. I'm pushing down into my hands. I'm pushing my shoulders away from each other a little bit. So from here to here, I'm pushing my head down into my hands. I'm trying to get as long as I can through my spine as I use that pressure for a little bit of help. I'm pushing down, I'm trying to get as long as I can from my sacrum to my head. And then I'm breathing here from this position. Go ahead, give it a shot. Okay, this is our banded quadruped deep neck flexor hold. So what we need is a long but fairly light band, and you can figure out what's the right tension for you. Our starting position is we're going to bring the band around the back of our head. Try to keep it above your ears. The higher the band, the more tension, or the harder we make it. From here, we're in a quadruped position. I want you to think long through the spine. So think get your tailbone back, get your head up, and then elongate through that spine. Try to make as long a spine as you can. And then from here, we're simply tucking our chin into our neck, creating a neutral neck position, and then pushing up. We just want to hold this position. The band is resisting us and trying to push us down. We want to make sure we're staying up and tight, keeping that chin tucked. And then we're hanging out here for time. Okay, again, this is great at working those deep neck flexors to make sure that we're creating that neck stability and turning on those muscles that have been quiet for so long. Go ahead and give it a shot. Okay, this is our short seated breathing drill. The idea behind this drill, the purpose is to get expansion into this upper back and even into the upper back and neck. So we're trying to get the muscles on the upper back to start to relax and lengthen and be in more of an eccentric state than a compressed concentric state. Okay, so with this positioning, we're gonna be reaching low, so kind of on an angle down low. I want you to extend your arms in that direction and then give me like a little reach plus. So reach and then give me just a ½ inch more. This puts those muscles in that just last little extra bit of length position where the scaps are just a little bit protracted. We never want max effort through here because then we get the traps, upper traps kicking on a bunch of other muscles. All we want is a reach and a little plus. Now we're perfect. We're gonna keep palms up towards the ceiling. It's a long inhale through the nose. Be longer than you want, right? Long, long, long. And then a very long exhale through your mouth like you're fogging a mirror. I want you to keep pushing, pushing, pushing. Longer exhale, 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 but let it take its time. Don't do it all at once. You want to be slow. And what you should feel is some of these muscles around the core and obliques really start to kick on to try to help push the next little bit of air out, out, out. Okay, so let it take its time. And you feel this core really turn on and it start to pull you down and in. That's what we want. Then I want you to hold that tension in there. So once you fully exhale, hold the tension, and then breathe back in through your nose nice and slow. The idea here is we don't want you to, as you exhale again, lose height through here. So as you exhale and this starts getting tucked down, I don't want you crunching down with it. Let it pull this down, but your head and your eyes stay exactly where they were. So we almost get longer through the spine as that happens. Hold that down there, and a nice big long inhale again through the nose. So we're just playing that game back and forth with these slow breath cycles. When it comes to sitting, have your back up against a wall. We don't want to be perfectly upright. We want a little rounded in that upper back. We don't need this low back to be flat to the wall either. So we have a little bit of space here. Then here on the lowish mid back, we start to reach the wall, and then we come up off that wall again. So we're in this slightly rounded position. The reach gives us a little bit more. And then as we breathe and exhale, we're just not letting ourselves get more rounded. We maintain that position. Okay, go ahead, give this a shot. This is our lat stretch. Now, this is going to work to lengthen the muscles of the lat, but really we're also working on expansion and creating expansion in different spots of the rib cage throughout the T-spine and upper thoracic spine. So what this position might look like is shoulder is holding onto something or hands holding on to something about shoulder height. From here, we'll kind of hinge back and we get this little rounding in that low back. I want to encourage a little rounding in this low back. That'll actually put the lat on a little bit more of a length. From here, I'd like to step back with the same side that my arm is forward, and then I reach through and underneath through here. So it's a slight reach. What we don't want with this position is as much tension through this lat as possible. It's not what we're looking for. We should just start off with a little stretch here, a little bit more, and then just a touch more, like a 3 or 4 out of 10 stretch onto that lat. From here, it's an inhale through the nose and a long exhale through the mouth, like you're fogging a mirror. I want you to feel the obliques start to kick on and that core kick on as you're trying to get every last bit of air out. That is when you feel this rib cage really tuck down, down, down. That's what we want. This position is kind of opening things up. The exhale is going to close things back down just at the rib cage, and I want you to hold that tension. Hold that tension that you created here at the core and obliques. So next time you inhale, that inhale is kind of fighting that tension you've built here, and instead that inhale is going to go to that mid and upper back and start to open up the space that we're trying to put on a bit of a stretch. So this upper back and shoulder, and then this lat muscle, we're going to get this little expansion happening through that area. So we use the breath to help us with this lat stretch. Again, it's a little bit of a stretch, more of this respiratory component to help create expansion where we want it. This is the lat stretch. Okay, so we're being working and training through a DNS oblique position here, where we're going to focus on the shoulder complex and the back of the shoulder. So the position here is similar to our low oblique where we're here, except for we're going to bring our hips back down. Now the hips and knees shouldn't be up here at 90 degrees. We want it more straight, so maybe 45 degrees, even 30 degrees here at the hips. And then the knees here can be whatever's comfortable for you. It can be 45, it can be closer to 90, and whatever works best for you. Just don't let the knees come all the way up into more hip flexion. Otherwise, the weight is on my bottom side elbow here. I want you to work on getting this ear and this head as far away from that shoulder as you can without getting too aggressive up here like this. Think more, we don't want to get slouched into the shoulder, but instead we're always pushing that shoulder away from us. We're always pushing our elbow away from us. That's a good way to think about it. From here, all we're doing is rotating over this bottom side arm, turning trunk and sternum towards the ground, and then opening back up. Now, a few ways to do this right and make sure we're doing it right is to feel like as we start that we maintain this kind of push away, or like the scap is always kind of pushing out and away. And we want to think like shoulder kind of goes back as your sternum goes out as far forward as you can. So like the widest arc you can make. And we should get this almost stretch there through the backside of the shoulder as it contracts. So it's kind of a working stretch as we turn and stay down. Even from this position, I want us to feel like I'm keeping this elbow as far away from my shoulder as I can. So it's this same feel here that we maintain throughout. And I want it to almost be like our chest is going up into our rib cage here the whole time. All this just to keep us from getting too slouchy through here. We want to keep that push away tension. Keep that especially on the way up. Again, trying to keep that wide arc on the way back up when we finish in that same position. So we can really work on lengthening the muscles in the back of the shoulder, training through scapular stability and motor control, and centrating the shoulder joint in a position like this, where we need to focus right here and take some of the pressure and focus away from the hip. If your knees come up too high, you might feel like the lumbar spine is turning and twisting, which can be fine. But again, to keep a lot more focus, what's happening here at the shoulder, keep your hips in less flexion. Give it a shot. Okay, with this exercise, we are doing a banded posterior delt reach. So a great position for this would actually be about shoulder height, and we're going to pull across our body. When we have it in this position here, we can target this posterior delt muscle, and in general, we can actually just target the muscles around the shoulder joint. Now with this, we're going to be very precise with the way that we do this. So this isn't just a posterior delt exercise. Instead, I want you to start this movement by reaching or protracting your scap. So I want you to think about reach your arm just about as far as you can without your body moving with you, and then give it another ½ inch, right? So reach plus. This is going to be our position. What I want you to do from here is keep that reach like you're dragging your knuckles in the wall in front of you, and you're reaching for that wall, and pull and do this pull across from that position. So you're always going to keep this reach, 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 reach throughout the entire motion. And what that's going to do is it not only kind of really targets that posterior delt and the muscles around the shoulder, but it takes some of the emphasis away from the upper back muscles, right? So a lot of times as we do this, we'll set the shoulder in, we'll get it locked in, but what will happen is a lot of the motion is just the scap moving across the back like this. It's kind of the shoulder and the back are kind of cemented together, and we just get the scap moving, which changes the orientation of the shoulder. Now, there's always shoulder motion, shoulder movement there, and the muscles are working. But a lot of times when we have shoulder pain and shoulder range of motion loss and other dysfunctions, is we don't want these two things working as one unit at the moment, right? We want to have the ability to separate those two things. And then when we lift really heavy weights, we want to make sure we create a good base of stability. But the question is, are we training the shoulder right now, or are we training the back? We want to make it all shoulder. So we get to separate, kind of pull the shoulder out of the scap a little bit there, kind of separate it, and then use it and create this abduction moment there and create some space at the shoulder joint, as well as strengthen some of the muscles that help make that happen. But above all, we can turn this into a motor control kind of shoulder capsule opener by doing the motion like this with that reach, and always prioritizing the reach above anything else. You need a very, very light band for it. And then later on, we can go back to really building that shoulder complex strength with all the components working together. We just need to make sure we have that mobility back into that shoulder joint as well. So go ahead, give it a shot. Okay, these are our banded shoulder separations with reaching abduction. What we're trying to work on here is protraction of the shoulders. We want to work the muscles, true muscles around the shoulder, between the shoulder itself and the scapula, and not get overemphasis of the bigger muscles of the scap and upper back. So we want it to be a true shoulder movement here. And then we get to work on some golf sequencing and just a little bit of the important separation between trunk and shoulder that we get, especially on the lead side, but we can work on these qualities on both sides. So in this case, I'm working on my right shoulder. This is what the drill looks like. We get a little bit of tension in light band. Feet are square to in front of you, kind of 90 degrees from where the band is pulling. Let your arm come all the way around as we're kind of pulling across the body. Belt buckle will then turn, or feet don't move, and your sternum will turn with it. So now we got this arm. I want to reach it away or kind of like out of the socket. Keep that reach the entire time. That's the hard part, is always keeping this kind of forward reach no matter where we are. From here, see if we can bring belt buckle back to center. without this arm moving and without the trunk moving too much. Now the important part, can we pull and turn this trunk into this shoulder, again without the hand moving, it's always staying reached in a way. And now we've just worked on the equality to create some stretch through here at the shoulder. So to turn and then turn the trunk into that shoulder without the shoulder moving allows us to get here, turn into it, and create that kind of separation at trunk and shoulder at transition in the golf swing. We also get to work on opening up and creating space and kind of working on the junk that can happen here on the shoulder of just getting the scat moving on the shoulder blade, or sorry, the scat moving on the rib cage, and getting that shoulder, the ball of the shoulder, into different positions in that shoulder joint, which can be really helpful for a lot of folks. We want to make it as comfortable as possible to get coming across the body like this. It's important for a lot of different reasons. So that's the initiation of the drill. We're here, this reach, this doesn't move, belt buckle, sternum. We're always keeping that reach, and now we can finish without the trunk moving to help with this little abduction moment. And you'll feel those muscles around the shoulder that we just kind of put on a bit of a stretch, now really working to contract and pull us across. Again, the trunk and the pelvis is just working here to stay stable and neutral while the shoulder moves on top of it, okay? So work on this subtle but difficult move and make sure you go slow and controlled, even if it's a little, it's important. And then always keep that arm reached, like the knuckles are always reaching as far away from you as you can as you protract and abduct across the body. Go ahead, give it a shot. Okay, for this exercise, we're using a wall or a door like this. Feet can be as far away from you as is comfortable, whatever's easiest to get this low back to be flat to the wall. So we have to think belt buckle comes up towards your belly button, going into what would be a spinal flexion at the lumbar spine. So if we can feel like our low back doesn't have this big arch down here at the bottom, but instead is flat to the wall, then we're happy. From there, we want a spot on your mid back and then the back of your head. So we've created this kind of length through the spine. We've created extension through the thoracic spine on top of what should be a neutral or flexed lumbar spine. In this position, pelvis and rib cage are kind of stacked on top of each other. That's perfect. Now you're not allowed to go back into lumbar flexion. All of these spots, into extension. All these spots have to stay where they are, flat to the wall. From here, you're going to put some tension into the band. So you're going to rotate your hands or wrist into the band like this. What we don't want is this motion, but instead this motion. So the elbows stay where they are in space and you rotate into them from there. So once we build that tension in the band, from here, we're just going to press straight up overhead as high as we can before we let the elbows start to flare out like that. So we press, keep it as much or as close to overhead as you can before we come back down. Think 4 seconds on the way up, a second or two hold at the top, and then 4 seconds again on the way back down. Again, we don't want arms out here like this. We're not doing this, but instead elbows kind of start bent right here, and you're trying to keep that tight as we go up, 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 and then come on back. Slow reps through here. Own it. Let the shoulders work. Let the mid back work. Whatever is kind of most restricted on you is what you'll feel the most in this position. You can build a lot of stability and strength and mobility through the different parts required for this. We need lumbar flexion. We need thoracic spine extension. We need good external rotation here at the shoulders. CT junction extension plays a role. And then again, just the shoulder complex as a whole needs to be able to get to these different positions. Go ahead, give it a shot. Okay, I hope this helped. When it comes to the cervical McKenzie positions, this is something where we can work into anywhere from 100 to 300 reps a day, whether it's our lying extension or seated extension work, whatever it might be. Simple reps, doing them correctly, getting volume throughout the day is usually what we want to shoot for. Pay attention. Do you feel your symptoms centralizing or the referral patterns being minimal or less, or we feel more of the symptoms closer to the neck as opposed to farther away? That'd be a good sign. After that, when it comes to ribcage expansion, breathing positions, trying sets of where they usually last about 45 to 60 seconds is a good place to be. And then when it comes to any of our stability movements or positions, working through rep ranges, if you do them correctly, usually we don't need too many reps, but just reps until we get to a fatigue point where it becomes really, really, really difficult to do, but we're not losing out on our positioning, which is the most important part, right? In the first place is we want to get you in certain positions and then working from there. So as long as many reps as you can do, slowly controlled in the right positions, that's what we're looking for in that case. Thanks for watching the video. If you liked it or if it was helpful, give it a like, share it, subscribe to the channel. Let me know, what do you want to learn more about? How can we help? Golf specific, fitness specific, and rehab specific.